welcome to everybody today. It's a huge honour to have been asked to take on the chair of the national panel, and I'm really keen that I do everything I can to make the panel's work as useful and relevant to you as I can. So I'm really looking forward to working with you all, and I'm delighted to see so many of you have joined the review seminar today. One of the things that I've been asked to do as the panel's new chair is to increase the panel's analytical ability and capability, but also to really focus on sharing and producing good practice resources that are really accessible to practitioners. And so that's going to be a big focus of the panel moving forward. And it's something that I will need your help with too. So what I wanted to start by doing is introducing you to the panel. And as you may have seen in the past, the panel has a multidisciplinary membership. We have representatives with experience from social care, from education, from health, from the police, and from other agencies who are key safeguarding partners. I myself have a background in children's social care, in health, and in the voluntary sector. And recently we have been busy recruiting some new panel members. And so from November, I'll be able to introduce you to some new panel members too. I can say a little bit more about our task of increasing our analytical capacity. Now, as you probably know, the panel has a key responsibility to review all rapid reviews and local child safeguarding practice reviews that are carried out by safeguarding partnerships across the country. For many safeguarding partnerships, you'll be involved in one of these reviews, perhaps just once a year, perhaps less. A few of you may have more. But the panel is in such an incredibly privileged position because it sees 15 to 20 of these rapid reviews and LCSPRs every time it meets. And we meet fortnightly. So we very quickly, even in my first 3 months in role, have seen probably 100, 120 rapid reviews and LCSPRs. And so we see a huge amount of information coming through. We also see a great deal of information about emerging safeguarding themes. We hear a lot about good practice, but we also understand a lot about very serious incidents and what might have gone wrong in particular cases. And so we have a huge responsibility to share that learning with the field. And I'm keen that we do that as actively and proactively as we can. Traditionally, the panel has often produced very detailed national reports, and they of course have tremendous merit. But I'm also very keen for us to explore new and different ways of sharing information with you, whether that's through examples of cases that have come to panel in the form of case studies, whether it's in short form briefings, some filmed resources, some infographics, really thinking hard about how I can make and how we can all make the information that is coming to our attention as useful and accessible to you as possible. So that's going to be a big focus moving forward. So as part of that, we are redesigning the way in which the panel communicates. And I'm really pleased to say that we are currently designing and developing a new panel website that will go live next year. I hope early next year. And we want to make sure that that will ensure that you have access to the latest tools and opportunities to share best practice. Okay, so this slide contains information that came from the panel's last annual report. So for containing data about information that came to panel in the year 23 to 24. And I just show this information as an example of the sorts of information that the panel holds. As you can see, over that whole year, we considered 330 serious incidents affecting 485 children. And in that year, indeed in this year too, the most common age group of children coming to the attention of the panel were babies, with under ones making up a third of all incidents. And you'll see more information on this slide about sort of high level statistics that we were able to gain from that whole data set. What I want to move towards, though, in the future is being able to share this information, not just in the form of annual reports, but I hope we'll be able to get to a point where we're able to report through our website every quarter on information that is coming to the panel and cases that are coming to the panel. And I hope what that will enable us to do over time is give you more real-time information about the cases that are coming to panel, but also the safeguarding themes that we're seeing. So, for example, in recent cases coming to panel, just over the last couple of months, I've seen more cases coming which have had online elements of online harms to children. And I'm really keen that we are able to get that real-time information out to you as quickly as possible. And so that can in turn provoke discussion with you, but also discussion about whether that's reflecting what you're seeing in your own practice locally, and whether that national overview that we can provide can then also really help you to have those conversations in your own local partnerships too. So this is where I ask you for your help. I'm really excited that we're developing the new website. We want to make it as user-friendly as possible. I don't want to duplicate other resources that already exist. So I know organizations like the NSPCC, Research in Practice, foundations already have fantastic resources. This is an opportunity for us to use the information that the panel has, those most serious incidents that come to our attention, to find ways of sharing key messages from that information with you really well, but also finding ways for us to share resources that we identify that are really great learning resources that may have been produced by local partnerships and we think could be shared more widely, or resources that we create ourselves to reflect learning that we're receiving from the reports that come to us. So we will be inviting you to join an expert reference group, if that would be of interest to you, to help us get this website right, to make sure that the user experience of it is going to be as good as possible, to make sure that the way in which we're structuring the content reflects what you think will work best in practice. So we'll be inviting you to express interest in joining that expert reference group and helping us to get that website right in our next newsletter. And I'm sure my colleagues in the panel secretariat will be in communication with you to help you know how you can get involved. I'm also really keen to make sure that it's not just the panel creating resources. I see some absolutely brilliant resources that are created by local safeguarding partnerships through the work that the panel does in reviewing rapid reviews and how and LCSPRs and how safeguarding partnerships have responded to the issues identified in those reviews. And I'm really keen for us to share the very best of those resources on this new national website, panel website that we'll be creating. And I hope that in time, there will be a real opportunity for us to work closely together, not just in getting the website right and getting the navigation on it right, but in also getting the content of the website right as we move forward. So I hope that at least some of you will be interested in working with us, helping us to make sure that the content is what practitioners need, helping us to review content to make sure that it's the right content to include on the website, and that together we can co-produce a resource that will be of national use and relevance. So that's the journey we're on, colleagues, and I really hope that you will want to get involved with us in doing that work. And I also want to say that I absolutely understand that the cases the panel look at, review, are these most difficult and serious incidents. We always keep in mind the brilliant work that is being done across the whole country to keep many thousands of children safe every day. But we feel it's incumbent on us to do everything we can to learn when things have gone wrong and to share that learning in as accessible and meaningful a way as possible. So that's our task moving forward. Thank you very much for your attention, and I really look forward to hearing your ideas as this seminar develops. So back to you, Steve.
Great. Thank you, Sir David. So just the opening pitch, what the opportunity now is to either use the raise hand icon in Teams and you can ask a question directly, or you can add into the forum, or if you're really struggling to get to the forum, then please add it into the chat here on MS Teams and we'll pick it up. So just a bit of a narrative already, and then I'll come to Chris Miller. Of course, it would be good to have the names of the panel on that slide. One colleague has said, so we can do that. That's a good fix. And also, I think the updated website will help explain who's on the panel, what their backgrounds are, and so on. Bit of a challenge, Sir David. Is it possible to ensure that we refer to children rather than cases? I know it sounds pedantic, but the language you use does have real impact. That's a colleague adding a question number 5. Somebody has responded to that. Yes, we agree, but also some cases reviews involve multiple children, of course, so sometimes you need to differentiate. Another comment is it would be good to see neurodiversity separate to mental health. I think that's following guidance around how to differentiate between those needs. And we have made a note of that. The panel took steps earlier last year to commission a review focusing on neglect. Please can you advise if when this will be published? And perhaps one of the team can add a response to that. Yeah, we'll pick up on some of those other questions, but I want to go to the people who have their hands up, and I believe that is we've got one. Tony Lewis, yeah. Welcome.
Thanks, Steve. Good to see you. Thanks very much. Hi, David.
Hi.
Welcome to the role, and all the very best in post. David, I'm partnership manager down in North London and Barnet, and I just wonder at the moment whether there's a scope to kind of consider the sort of fragmented nature of reviews really involving children. We sit across a number of not just local child safeguarding practice reviews and rapid reviews, but there's offensive weapons, homicide, reviews, domestic homicide reviews often involving children, child death reviews. There's an awful lot of reviews and learning in a very kind of complex multi-agency system. And my kind of experience talking to my partners is that there's a lot of partners with a lot of knowledge sitting in very different places, and it's not often brought under one banner. I just wonder if there's any scope going forward over the sort of year ahead and more to sort of look at that and how we can kind of consolidate some of the learning from a number of those review strands.
I think that's a really good challenge, and it's very much in the spirit of how I'm seeking to work, by just making as many links as I can with other organizations, with other government departments, with other systems, to make sure that we're gathering as much learning as we can, but also that we're triangulating the learning that the panel is seeing against other sources. So a really good challenge. Those are conversations that the panel and the Secretariat can have moving forward. But I think what is essential is that learning that's coming through the panel, if that's also being seen from other sources as well, that strengthens the need to get those messages out even more clearly. So yeah, really, really good comments, and something that we can take forward.
Thanks, David.
Great. Thank you very much indeed. And Carl Mumford, you have your hand up.
Good afternoon.
Hi.
Yeah, thank you for your time. I went to the IPRI conference earlier this year of child online harm, and the sort of scale that's taken place is unfathomable. And one of the concerns I had from that, and I was the one that put in the chat about the neurodiversity conversation being separate from mental health, is the vulnerability of children, or the contextual vulnerability of, say, an autistic child online. And one of the concerns I had from that conference was the lack of data around neurodiversity that exists. And I was just wondering what outcomes have been considered so far, or the conversation is around how we improve that across the board. I've been a police officer, and the data that's being collected from police forces across the UK isn't good enough. And I'm just wondering what considerations are being made to improve that across the board, really. Thank you.
Okay. Again, really interesting question, and yes, you're right that neurodiversity is an issue that often comes through when we're understanding the children who are featured in the range of reviews that come to panel, and actually understanding the vulnerability of those children in a safeguarding context as well is really important for the panel to be able to speak about as authoritatively as it can by sharing the evidence that's coming through its reviews. So again, I think that is a theme that it would be very useful for the panel to explore through the resources that it's creating for this new website. And also, just Steve, if I may, just to pick up one of the comments, the questions that came through, just to say, yes, we have, the panel has done work on neglect, so that thematic report is being finalized at the moment. But what I'm also really keen to explore with that work that's been done is how we can also use that in the context of developing resources for the new website, so that as well as being a standalone report, we're also using that content that has been created, the really rich content, to actually provide, I hope, a range of useful resources that can go on the website too. I'm mindful that how useful it would be to have resources that could be taken to a team meeting that might provoke a conversation in a team meeting, and that don't necessarily require somebody to read a 100-page report. So I want to make the learning as accessible as possible.
Excellent. Thank you, David, and thanks for picking up on the neglect review. There's another comment which is 36. It would be helpful to make the most of the NSPCC repository and resources and briefings instead of producing more stuff. I know your plan is to kind of make the best of all the available resources. Are you working with the NSPCC?
Well, as you can imagine, a key introductory meeting that I had was with the NSPCC, and I'm well aware of the excellence of their resources as well. But the panel is also coming from a place where it owns its own information as well, which is the information that comes through the very serious incidents that come to it. So I'm keen to start with what the panel is seeing, but then to sort of expand out from that to identify resources and link to other resources that are on the same theme. So I think we can do both.
Okay, good. Because it kind of leads nicely onto the following question, which is number 37. Somebody is saying, I think it would be valuable if the national panel helps to tackle the perennial problems. You identify the key themes as secrecy, barriers to disclosure, information sharing, professional curiosity, workforce stability, mental health, and so on, online harms. The effort needs to be more focused beyond the learning and how we change these.
Thank you so much for that question, because that's absolutely where I am as well. So, I think for those of us who've worked in child protection for 30 years, we're all aware, aren't we, of the issues. I agree that we're aware of a lot of the learning as well, but then it's what then do we do about it? What makes a difference in practice? And I think there is a real opportunity for the panel to identify not only the issues, but also how they're being addressed and what's working, and whether we're doing that through webinars, whether we're doing that through other resources. It's about having the discussions about what works and what has made a difference in tackling those issues. So I think it's a combination of resources and discussion, but also making links to everybody else that has something to say and that has learning to share, and making sure that we're really open to have those conversations. So yes, that's a great point, and one that is very much on my radar.
Brilliant, thank you. There's a debate going on in the MS Teams about the AI, the Read AI bot that has arrived. I think if any of us have AI running, then hopefully that's for your own notes, but I think somebody may be offline and they've sent their AI bot to the meeting instead of them, and it's also emailing people. So we'll try and get to the bottom of that. Please, one of the go on,
Steve, sorry, can I also pick up the question that you raised before from the colleague who talked about language and
yes,
the terminology, children or cases. Thank you again for that observation. Really helpful. And this is another reason why we really want to make sure that we're testing our website, testing the content of it to make sure we get it right. And this is a resource that I hope will be useful for everybody, and with your help we can get it absolutely spot on. So thank you for that.
Yeah. Excellent. And just to reiterate that, question 34 as well, just let me find that, talks about learning from successes as well. I know you're keen to do that, yeah. Particularly one of your 3 main conclusions today was to introduce it to this showcase of local excellence. What do you imagine are the sort of types of things and the situations where people will feed back to the panel based on those examples of local excellence? And as I said that, Sir David froze for me.
Well, for example, if we sorry, let me just start again.
Yeah, thank you,
Steve. Can you hear me?
Yes, okay. Perfect. Now so you're back.
Fantastic. So colleagues, let's just take that group of children who are the biggest group that come to panel. So babies, children under 1. So often we're seeing those children coming to panel because of non-accidental injury. Often we're seeing them coming to panel because of co-sleeping and death from co-sleeping. So I know that across the country, safeguarding partnerships will be aware of these issues, and many of you will have provided or developed local resources in order to really focus on potential harm to children, for example, from shaking or from co-sleeping, and giving advice to particularly to parents, new parents, about that. So it would be great if everybody didn't have to start by developing those resources themselves, but we're able to sort of use resources that have been produced that are really brilliant and that you're really proud of, and that if we're supporting you to actually have a platform to show resources that you're really proud of or that we've identified as being really fantastic, so that people can use them, develop them, and not have to start from scratch. So that's an example of the sorts of ways in which the panel could support.
Good, thank you. Let's pick up on the comment 38, which is about analytics, David. So you mentioned the panel is expanding the analytical capability and capacity. One of the real challenges for local safeguarding partnerships and business units is not just about gathering information from agencies, but moving towards genuine analysis of serious findings from serious incidents. Do you see the scope for the panel to broaden this out into national training, or detailed sharing guidance for local areas, longer term support of the kind that could be strengthened for local reviews, in turn helping the panel with more consistent national learning? And I think there are also some supplementary questions there about how do we get that learning down to the frontline workers, the people who perhaps would find the most pragmatic use for that learning. Want to pick that up?
Yeah, I think that's really interesting. So, particularly the link to training and identifying subject matter for training. I think, yeah, I think we could consider that to the there's two questions there. There's one about identifying the topics that require training. There's another one about who's delivering it. But I think that is really interesting. The other point about developing detailed guidance, again, it's being really specific, I guess, about what those key issues are that partnerships are struggling with, and where the most value can be added in developing additional information, but also I think remaining really alive to the fact that somebody somewhere may already have done that, and so
Yeah.
I think putting out, calls for resources as well on specific themes in a really well managed way, so that when an issue is identified, we're really exploring what already exists, what could be used or represented, or where there are genuine gaps and something new needs to be created.
Good, thank you. Anybody wish to pick up on any of the comments or questions in the forum? Just let me know, and happy to take any other verbal questions as well. There's a call here on 61, David. This says some national guidance would be welcomed in relation to very complex CSPRs, particularly when they involve delays due to police investigations, subsequent court procedures, sentencing and child death review panels, etc., which may restrict information available to the CSPR and or cause significant delays, particularly where there is uncertainty across multi-agency partners about the information that can be divulged when and to whom. So this is this problem of the really serious instances being delayed through the court process and police process, and the need for a rapid review or an LSPR to get the learning extracted.
Yeah, I absolutely understand that. And, already just in my first few months, I have had conversations with a number of safeguarding partnerships who've wanted to talk about specific situations that they're managing that may have a complex police investigation at the same time, and wanting to talk to panel about what it's possible to do in the face of that complexity. And so what I would say is, please remember that you can always speak to the panel. You can email the panel website, the Secretariat website, and somebody will always get, email address, and somebody will always get back to you. And if needed, we will always arrange a call with me or with a panel member to just give some advice about managing your local circumstances. I mean, what we would always say is it's good to get that rapid review done as soon as possible to get that early learning out, but that we understand the complexities. In some cases, we're able to give extensions. We're able to sort of just have really sensible, practical conversations with the safeguarding partnership about how to manage the situation. So do get in touch with us if you're struggling with a particular set of circumstances and just need some advice on how to move on and move forward.
Yeah. And I think in addition to that kind of level of guidance, there's a question about one of the challenges is the inconsistency of how agencies and partnerships present their findings. Everybody has a different opinion, often different formats, variable levels of analysis and repetition of chronologies. Has or will the panel considered standardizing the templates for submission or submissions?
Yeah, again, really interesting question, and something that I will be looking at carefully. I agree there are a range of different presentations that we see, and there are some I think real pointers that we can give in terms of what actually makes a report as robust as possible. So we need to take that away and think about further guidance that we can give.
Great, thank you very much. And yeah, there's a good deal of debate going on. A lot of these questions we will pick up with afterwards and give you a more substantive response, and that will be published alongside the video of this webinar, and a chance again through the website to interact with the panel. So I'm just going to pick up one or two of the comments in the MS Teams chat. So not been able to add to chat, but significant research from Swedish colleagues around health and well-being impact on online sexual harm is in many instances being more significant than direct abuse. And there's a link to the paper there, Digital Shadows, Meeting the Needs of Children Affected by Online Sexual Violence in Barnahus. So there's some good international stuff there, and that's kind of widening the scope to seeing what is best practice and good practice coming from around the world. Lisa Farmer is saying, given some new pieces of legislation that have been brought in, partly in response to repeated weaknesses in practice in CSPRs, such as the Children's Wellbeing and Schools Bill, it would be useful over time to understand the impact that such laws have had. We, of course, can take up these lessons locally, but it would be useful to have that information on areas that have improved as well as learning on a national level. So again, supporting the role of the national panel to kind of really, accentuate and pull all those key learnings. Okay. Yeah.
Steve, just if I could, and just another sort of contextual point. As we all know, there is a lot of policy thinking at the moment about the creation of a child protection authority, and I do think there's a really big opportunity for the national panel, while we wait for that policy to develop further, and to sort of explore some of the potential functions of a CPA. So I'm sure a potential function could be about creating and sharing more good practice resources. I'm sure another function could be about identifying emerging safeguarding issues and themes. And so there is potential here if we all work together to really inform the development of some aspects of a CPA, and I think that is a challenge that we should just seize together.
Very good. Thank you very much indeed. So I want to kind of move us slightly on, because this certainly is about how the panel intend, through Sir David's leadership, to shift the discussion and make sure that we are delivering to the safeguarding practitioners what they need. But we also wanted just to reiterate that sense of showcasing local excellence, and perhaps talk a little bit more about the expert review group that you talked about, which we'll be notifying and asking for volunteers for in the next newsletter. But there's a couple of questions we thought we would pose to people. So you can either, again, add into the forum as a response, and there are two prompts basically that you can see now. They are, what are you most proud of in terms of local resources? When does it actually feel like this is progressing, and what are you proud of? There's a great deal of stuff being shared in the forum and across the MS Teams chat, of papers and insights and good practice. So one of the roles here is to try and kind of collect that. And I, again, happy for anybody to come off mute and talk about what they're most proud of in terms of local resources. And that second question in the green folder, just click that and it says, what are you most worried about at the moment? So perhaps put some ideas in there, and then we can pick up on them and talk about them. So I'll just be quiet for 30 seconds to let us get ahead of that, and David and I can read what's coming in, and then we can pick up on some of those themes and content. There's a few people who aren't in the forum, but if you can possibly get to the forum, there's some really great stuff going on there. And again, we'll disseminate this information back to you. But I've just been looking at the most proud of 7-minute learning outcomes and publications get a mention. So the 7-minute briefings using system theory to inform improvements. Be delighted to know more about that. If you did that, write that in. You can edit that and perhaps add a web link or something to that. You can edit your own comments, not anybody else's. We are using Canva to produce short videos to go alongside policy and case reviews. Brilliant example of how to disseminate the good practice, the learning in kind of quick and meaningful ways, so that your practitioners and colleagues have a chance to kind of absorb it quickly, because they're obviously hugely busy. True multi-agency collaboration, recording training that can be accessed at a later date, making assets of the training material. Our safeguarding newsletter, partnership commitment to co-production, creating workshop sessions to safely discuss what recommendations mean for practice on the ground, i.e. it's silent. Partnership websites, local safeguarding newsletter, briefings, bite-sized webinars to share learning, multi-agency training programs. So a great deal of good practice and good shared practice. Reflective learning reviews for cases that don't meet the criteria. So not just doing learning reviews when the criteria are met, being reflective and open to development. Our rapid review process and the way we monitor progress of learning and impact via our reporting systems, including audits and quarterly impact reports. Number 54 is saying our redesigned website, newsletter, and our 9-minute briefings, an excellent multi-agency engagement in rapid reviews, LSCPRs, and all partnership activities, plus practitioner learning events. So there's an awful lot. David, what are you seeing in that list? It's we will do some analysis and, of course, group this later, but that's some great stuff.
Yeah, it's a great list, and there's lots for us to follow up on there. I'd love to see Stockport's guidance on safeguarding under ones, for example. But also, I'm really pleased to see some references as well to reports that the panel has previously produced, which is great to see. And also to say that in thinking about developing resources, we're not just going to develop new things. Where we've produced resources ourselves, reports that have been well received, then there's a lot that we can do to use the content of those reports, but just to present it in different ways, in really accessible ways, in different formats. And so we'll take that away as well. But thank you everyone for sharing all of those ideas and thoughts. It's really rich, and it's brilliant just to see the amount of energy in the webinar today. So yeah. Thank you.
Good. And of course, just looking at the most worried about, there's quite a few themes coming there about the difficulty of actually implementing learning. Number 19, recommendations that don't address the significant issues. So the level of the recommendations and the impact of that recommendation is not having the effect it was designed for. Responding to disproportionality effectively. Learning and change from reviews not being implemented. You can see the theme coming out of there. Delays that cloud responsibility. It's not like that anymore. So that question we had about delays because of police procedures or review procedures. Lack of impact, lessons are not learned, and reoccurring things. There's a big reoccurring theme about how best to land the learnings and implement them as fast as possible. 78 says impact of high turnover of staff and cuts, changes to services mean more limits to resources. Increasing role housing issues play in vulnerable families, and the challenging engaging with housing colleagues at a strategic level to engage them in safeguarding the families they are working with. The potential loss of the independent child protection conference chairs. So a structural question there that people are questioning. Delays in publication due to criminal proceedings we talked about. Thank you for that. Political interference. a lack of understanding about review processes, including anxiety about sharing information, long-term impact of online harm. These are some absolutely appropriate things that people are worried about. Increase in poverty, corporate memory not recognizing work that is already happening and failing to collaborate. We will do some work on these to group these and then respond back to you in terms of the panel's response, or indeed their intent around some of these things.
Steve,
David,
can
a
I
couple of
can I
comments?
just
Yeah,
make
please.
can I just make one comment? I just you know, so many things to talk about the context in which we're all working and safeguarding resources, resource constraints, etc. But I just wanted to highlight one comment that I just think was absolutely hit the nail on the head for me, which is not just focusing on creating and disseminating resources, but on how they're being embedded. And I think that's just such an important point, isn't it? Because there is so much learning, not just about creating a resource, but then really thinking hard about how it's going to be embedded so it actually makes a difference and does have an impact on practice, and people really do learn from it, and actually the process you go through to check that it's made a difference, but also what you learn from getting that process right and then sharing that learning about getting the embedding right. So yeah, I think that's really interesting as well, and that's something that we could apply to so many different issues that we're all working with. It's not just the issue, but it's what we did about it and whether we can show that that actually made a difference.
And so, David, do you think this is the kind of stuff that you're expecting around the showcasing of local excellence? Are these the kind of type of initiatives or outcomes or shifts, requests almost?
Everybody, we just need a conversation. It's conversations like this that help us really to zero in on the areas where we can make the most difference, but also where the gaps exist. So this is exactly the conversation we need. And it's also why we're so keen to create this expert reference group, so that there is a link between the panel and directly into practice, because I think that's the best way for us to ensure that what we're doing is really helpful and making a difference.
Great. We have a few minutes left, so I do want to make sure that anybody who wishes to has a chance to come off mute and raise a question or pick up on a point. And thank you for keeping it coming in the MS Teams chat and also the forum. Great. We have a question. So let me see who that is. Oh, Alison Cutler, Chair of TASP. Alison.
Chair of TASP, yes, also in Surrey. Hello, David. Nice to
Hello.
see you again. One of my questions that I've been chewing over, and I put it in the forum as well, is how we engage, how the panel can perhaps help engage with our LSPs and DSPs, because so often when we're working, business managers, support teams, we are right on the front line of working in these reviews. And what you've said about impact is so true. Impact is everybody's responsibility, isn't it? It's how we get that information out, what agencies do with it. But I'm so aware that people are so pressured. And I wonder, LSPs can feel quite removed from what we're doing with reviews. And I just wondered if there's anything more that the panel could do to help with that in terms of engagement of LSPs, and probably to a lesser extent DSPs, because DSPs are more likely to be more involved. So I suppose that was my question. Thanks, David.
Well, let's have a conversation about what that could look like and what might make a difference. It's essential that we're reaching out to people who are absolutely at the cutting edge and have all that knowledge. So let's think about what potentially we could do to really make a difference there.
Thank you, Alison. Susanna Bowyer, yes. In the MS Teams chat, Sir David, it says priority 1 in the learning support report from the panel commissioned is copied below. Any thoughts on this in terms of use in regional improvement structure? And the The quote is, national government should increase capacity in local child safeguarding partnerships using existing regional improvement structures. Significant pressure on public finances and proposed reorganisation of parts of the health system will impact on the capacity of multi-agency partners. It is critical that driving improvement is to better safeguard children is made a priority. Political leadership should support local areas to embrace emerging opportunities for collaboration and innovation. So that's the national panel's statement. A couple of issues to pick up on that. Is that on your agenda?
Well, that's very much a recommendation for national government, isn't it? And I look at that and I agree. But I think what's really important is that the panel does what it can within its own remit to make a difference, but also is evidencing to national government the difference that can be made by a really concentrated focus on sort of learning and sharing resources. We all would agree that this is a huge priority for everybody. What could be more important than safeguarding children and young people?
Okay, so I wanted to give Sir David the opportunity just now to reflect on what that first experience was, chairing the national panel, meeting our wonderful practitioners for the first time on a webinar. And there's a lot more work we can do. We're going to certainly process this information. We're going to make sense of it and feed it back to you. We'll publish the video of the webinar as well. But yeah, how was that for you, Sir David? What have you picked up from that?
Well, first of all, I really enjoyed it. I mean, it's brilliant to be able to have a conversation like this with so many people. Thank you for your energy and enthusiasm. Thank you in advance for the help you can give us to shape the panel's work moving forward, but also for getting this website right, for getting the content right, for helping us to identify resources that will really help, but also for helping us to identify issues where we can usefully make a difference and where we can have an impact. This isn't something we can do on our own. I need all of your help. So, thank you for your engagement, and I hope you'll want to work with us moving forward.
Very good. Thank you very much indeed, Sir David. So just a couple of things that will then underline and reiterate what you're saying about the continuing dialogue. First of all, for those of you, most of you are in the forum, I'm just going to switch into a quick evaluation question, which you normally get as part of a follow-up to this from Amina. But we decided to do this live and online. So there's just 2 questions, and then there's some further questions we'll come to in a minute. So please just give us a view on the level of satisfaction you have on the content of the webinar, and you can add any comments on that. So it's a 1 to 5 scale. 1 is very unsatisfied, 5 is very satisfied. You don't need to vote, David. And then the technology, the forum, this interaction, the anonymity, please rate that. And when you've just scored both of those and added any comments, you click the blue tick at the bottom right, and that will submit your vote. What we're looking at is triggering an ongoing process that will now run for the next 4 or 5, well, say a week to 10 days. And you will get a follow-up email for this. But we're looking to increase the amount of interaction between yourselves and the review panel. So what we are asking is a number of questions, and you'll see those topics on the left-hand side. What we're asking you to do is just click through those folders at your leisure. This will be open for 10 days. You can spend 20 seconds here, or you can spend 20 minutes in here. It doesn't matter. It will be added to by your colleagues, and you will see what everybody else is saying as well. So it's more of the interactive discussion rather than a survey. But we're looking at the prompts. So if you click on, say, future webinars, what topics of interest would you be interested in future webinars? You can think about local learning. Can you share examples of how you've embedded local learning? Please don't think you need to repeat what we put in for the elements that you're most proud of. we can actually condense that and put this into the report as well. And a number of other things. Serious incidents. Has there been a serious incident that has really impacted you and your practice? That is folder number 4, and so on. So hopefully I can see many of you already starting in that. Again, we'll repeat the link back to you in an email. That means you can join this for as many times as you want, for as long as you want. Perhaps even share it with colleagues so we can get their input as well. And we will disseminate the information that you share with us and make sure that we're listening in terms of future webinar topics and so on. Alison, did you want to say something else?
Hi, yeah, I was just going to raise the point that we've got a webinar with David ourselves at the Association of Safeguarding Partners on the 15th of October. So we'll look forward to picking up these conversations further then. That's it.
Brilliant. Thank you, Alison.
Thanks.
Brilliant. And huge thanks, Steve, from me to everyone for taking part today. Thank you all very much indeed.
Okay, thank you very much, everyone. Keep your comments coming into the forum, and have a good evening. Thanks very much indeed.
Thank you.
Thanks, everyone.
Bye-bye.
Bye-bye.